Giving birth is one of the most intense,
She's not that afraid.
You're gonna do this, okay? You're okay.
painful, emotional moments in a woman's life.
Ready? Go. Okay.
The baby's not moving. The heart rate may drop again.
The slightest problem is treated urgently,
They're both on the ventilator. They're both requiring a fair amount of support.
while major problems are indescribable nightmares.
We would consider them to be critically ill.
The worst case scenario is that she doesn't survive.
Every mother, every baby is living minute by minute. Kenya Fogarty is in agony.
I'm in a lot of pain, and I want to hurry up and have this baby. I just can't take it no more.
She's been having painful contractions for 28 hours, almost a full day since she received a labor-inducing drug. She's only 3 centimeters dilated. Kenya's being treated at Parkland Memorial Hospital in Dallas. More than 16,000 babies are delivered here each year, the most in the country.
I just came from the chapel praying to God, hoping that He deliver her, because I'm kind of scared, because it seems like at some point she get nervous and shaky.
A rise in her blood pressure and a deceleration in her baby's heart rate landed Kenya in the high-risk unit.
Whenever we see any decelerations, there's always a risk of us having to do any kind of emergent procedure, either do an emergency C-section, or if when she progresses to become complete, then we may have to do a forceps delivery or some kind of surgical type of delivery.
Breathe, you gotta breathe now, Mama. I can't even eat right now, you know. It's just that I'm worrying, you know, just being here and trying to be strong and make sure, you know, she make it through this, you know.
Less than 2 hours later, Kenya's condition has changed, for the worse.
If the blood pressure goes high enough with any kind of blood pressure like you hear about, she can have a stroke, or the baby could not be getting enough blood supply just because the blood vessels are clamping down.
She's going through these pains and it's shaking, and you're like, oh man, I hope she come through and the baby come through, or would there be any type of chance that she might not make it? So it's like a real nervous situation right now, you know.
Kenya is on the brink. If she improves, she can proceed with a normal vaginal delivery. But if she gets worse, doctors will be standing by to administer emergency treatment.
Where everything is. And today we're going to be measuring different parts of the baby's body so we can see how the baby's growing.
Adriana Ibanez is 33 weeks pregnant with her second child.
The head looks completely normal. This baby's been growing appropriately the entire time.
But things are far from normal. 11 weeks ago, Adriana and her husband Juan Carlos, both from Peru, learned their baby has a chest lesion.
The fetus's heart is having trouble pumping efficiently because of the mass on the left side of the chest has moved the heart over to the right side. The other problem with the fetus is because of the mass, there has been difficulty in normal development of the lung.
The extremely rare lesion contains a large fluid-filled cyst. The cause is unknown. The impact could be fatal.
We must have a lot of faith, a lot of faith in God.
It's a little bit, it's not that much. See, you can see that the heart's still pretty big. Yeah. When this fluid is at its worst, the heart just becomes a sliver on the side of the chest. But the heart seems to be pretty big.
In the past month, doctors placed 3 catheters in the fetal chest to drain the cyst. The fluid always returns.
Can you tell her in Spanish it's not going to be enough for a catheter? But I'm going to talk to Dr. Ramos, and I think we'll probably need to drain it with a needle today. Anytime you stick a needle into the uterus, it's a risky procedure, but it's certainly less risky than trying to place a larger catheter in. Adriana's very brave and very strong, and she's gone through it a number of times. She's gone through a lot of stuff for her baby. If we had not been performing these procedures all along, this fetus probably would have succumbed to death in utero.
En nuestro caso,
In our case, God has answered our prayers and has sent us some great people to help, like Dr. Coster.
Their faith will be needed more than ever if their unborn baby's prognosis worsens.
Dr. Bernice, I'll do 2B, please. And Dr. Bernice.
39 weeks into Jenny Barini's first pregnancy, something suddenly went very wrong.
Miss Barini came into the hospital today saying her baby wasn't moving. And when we do that, we put them on a monitor. And while we were evaluating her, her baby's heart rate dropped down.
I don't know exactly what's going on. Just I come in here this morning and my baby, my heartbeat, the heartbeat, my baby is coming down.
When you have someone saying the baby's not moving and you have a heart rate deceleration, that needs further evaluation.
Jenny's evaluation is inconclusive. It's not clear why her baby's heart rate dropped.
We elected to go ahead and deliver her today. What we'll do is she'll get Pitocin, the medicine to induce her labor.
What's this? For what?
What's the medicine to make you have stronger contractions?
And we'll watch her labor very carefully and make sure the baby tolerates that, make sure the heart rate doesn't go down anymore.
How long will it take?
About 5 or 6 minutes is what it takes for it to start working.
So when we start this medicine to induce her labor, the baby's going to go through a period of stress. If there's something more serious wrong, the baby's not going to tolerate that medicine. The heart rate may drop again, and it may cause us to proceed more rapidly with delivery.
I got a contraction right now, so yes, I tried on thinking that contraction, and they said make me feel better, so I don't, I don't feel really hard.
Making things more difficult for Jenny and her boyfriend Felipe is the fact that both their families live thousands of miles away in Peru.
She want to feel me because my mom is not here. We are not from here, so we want to send that video to my family. So he want to feel everything, so my mama can see everything.
I have many emotions now. It's my first baby, and my brother's not here, my parents not here, and we hope everything will be okay.
But my mama, no, she's a little scared too, because she don't know what's going on with me. But I'm okay. Okay.
You okay?
Jenny is 5 centimeters dilated.
Can you take some big breaths for me? Take some deep breaths for me.
If all goes well, she'll deliver naturally. If not,
We're ready to do a C-section within minutes. And here we can have the baby out in less than 5 minutes.
A couple of 20-gauge syringes and a longer 18-gauge needle if we need it.
doctors are about to drain the cyst that is critically affecting the heart and lungs of Adriana's baby.
¿Está nerviosa? Keep a little bit nervous.
She's not that afraid.
Okay, so there's your tip.
So it's down towards her feet. So then you need to bring your hand up like that. Right. Because of the size of the cyst, it obstructs blood flow, return to the heart, and it prevents the lungs from growing. So basically all we're doing is reducing the size of the cyst. Our needle is in the chest right now.
We can visualize it. It's a very bright white spot in the middle of the cystic fluid, and the fluid's coming out in the syringe here.
Okay, you watch the sono and I'll drain.
Chances are the mass has already damaged the baby's lungs. But because they don't function until out of the womb, the extent of the damage won't be known until after Adriana delivers.
This is the cyst fluid right here. It's pretty clear. Usually within the first day of life, we'll know whether the baby can be stabilized on a ventilator or whether or not it will need to be hooked to the artificial lung, the ECMO device.
Either way, the baby will be in critical condition.
They think they're in the best hands, so they're okay.
So at most, there'll be 2 more drainage procedures. That will be the most.
Cuando más va a haber 12 estratos de líquido más. Okay?
Okay. All right. We'll see you on Friday then. Okay?
Próximo viernes.
Thank you.
1 more week until the delivery. 1 more week until Adriana and Juan Carlos learn the diagnosis that could mean life or death for their baby. "30 hours into her labor, Kenya is still in severe pain.
I really put medicine in so they can reduce my labor, so I can hurry up, but it doesn't seem like it's not quick enough. It's not, because I'm in a lot of pain, and it hurts.
In the past 2 hours, she's gone from 3 to 5 centimeters dilation. Her baby's heart rate is back to normal, but Kenya's already high blood pressure is now even higher.
Her blood pressure went up to what we call the severe range, meaning that she qualifies for, or her diagnosis now would become severe preeclampsia.
Oh no! Please!
So based on that, we had to give her some blood pressure medicine to try and bring the blood pressure down to the normal range.
If we can get this done, it'll take maybe 5, 10, 15 minutes to get your epidural in, and then you'll feel a lot better. But it's going to be very important that you not push.
Finally, at 6 centimeters, her doctors okay an epidural.
One thing that we want to make sure is the baby's going to do all right, so Dr. Carlio is the 4th year, and he's going to make the decision to either proceed with continuing with a vaginal delivery versus doing some other surgical kind of intervention.
Just try to breathe. Just try to breathe.
So every time she contracts, it's squeezing the cord, the baby's not getting the blood flow. And she's only 6 centimeters. If it keeps going repetitively, then we'll probably go ahead and C-section her.
A day and a half of intense labor has left mother and baby exhausted. Weak and vulnerable, the upcoming rigors of childbirth could push both into critical condition.
Good, you can start.
Kenya's high blood pressure has dropped. Her baby's heart rate is normal. But after more than 30 hours of labor, her doctor decides a vaginal delivery is unsafe.
Sorry. Basically, she's failure to progress. She's been having adequate contractions with the Pitocin for quite a long time now, and her cervix is changing. So that usually signifies there's something abnormal with the labor. Either the baby's too big or the mom's pelvis is too small.
Uterine incision at 44.
We got it.
In less than 5 minutes, Kenya's baby is delivered.
Here you go.
45
Within seconds, it is obvious the baby is in trouble. The neonatal team discovers that his lungs are full of blood, making it difficult for him to breathe.
Suction a ton of blood out of him.
So, was he just not, did he just have a hard time breathing initially, or?
Just a ton of blood. As soon as they went in there, it's like no amniotic, it's just all blood.
Oh, okay, I see.
The presence of excess blood could indicate a placental abruption, a potentially critical problem where the placenta separates from the uterus before delivery.
Well, when they went into the uterus, amniotic fluid was bloody. So that's what indicates an abruption, because somehow the blood got in there, probably from the placenta.
Ready for surgeons in OR2. Ready for surgeons in OR2.
Holy cow, baby.
A severe abruption cuts off oxygen and other nutrients to the baby. If untreated, the baby can die and the mother can become very ill.
5. Just 5 pounds, 4.8. Isn't he sweet?
baby's airway, breathing, and circulation were fine. The baby appeared stable and active. We're going to send the baby to the newborn nursery and just follow him closely from there.
The baby's stable condition means that the blood during the delivery probably came from Kenya. How much she bled and why are critical questions that still must be answered. Elia Campos is undergoing an emergency C-section to deliver twins.
We tried to stop her labor. We brought her down. She got some antibiotics because the babies are so young. We tried to give her medication to help her be comfortable and not contract. That didn't work.
Elia's twins are dangerously premature, only 27 weeks old, a full 3 months early.
The problem was that the first twin was coming out backwards, or what we call breech. 27 weeks, right?
Breech is a transverse, so.
Usually when they're that premature, the babies cannot tolerate labor, so we go ahead and perform a C-section. The second baby was also transverse, meaning it was coming out sort of like doing a swan dive.
The fragile state of the babies calls for an unusual type of C-section.
Usually when babies are so small, like I said, they don't tolerate labor or a lot of the jarring that goes on with delivery. We had to do a vertical C-section.
You all right?
I'm trying to feel something that I can recognize.
Knife, please.
Elia's babies are so premature that they are at risk for being born with life-threatening problems.
They'll most likely be on a ventilator, and they may have problems expanding their lungs because they're too premature and they can't develop the proteins to help them expand their lungs. They can also have problems with bleeding in the brain and bacteria invading their intestines.
The babies, both boys, are delivered 3 minutes apart. Both weigh less than 3 pounds, and both have breathing problems.
All right, you ready? Okay, we're gonna make a beeline over there. Ready? Go.
The twins are rushed to the neonatal intensive care unit. There, doctors will utilize every resource available to treat the severely ill babies.
I'm going to lower your head and you're going to straighten out.
Taiisha Neal is close to delivering her third baby, another girl.
Nothing. I felt a little pressure, but it's nothing compared to what I was feeling at first.
But it's the first time she'll deliver with the help of a nurse midwife.
Okay? Just 2 fingers here.
Helen Vega is Taiisha's midwife. She's one of 40 midwives at Parkland.
Women that are anywhere between 36 to 40 weeks pregnant, that have had no big complications in their pregnancy, and are expected to have a normal vaginal delivery, and that's what we get over here, basically. She's like 8 and +1.
Oh, great. Look at that.
You're doing really good.
You're doing great. We'll have a baby here in no time.
What those midwives do is provide very comprehensive care. They are involved with as many as maybe 50% of all of the patients who come through Parkland Hospital.
I had been in nursing for almost 30 years and had 12 children of my own. So that's what got me into midwifery.
You're cold? Okay, I'm gonna get you a warm blanket.
On your side. I want you to lean on that blanket. I want you on your side. Helps the baby work his way down, okay?
As the minutes tick by, Taiisha's pain grows more intense. The nursing staff continues to monitor her progress.
She said she's feeling pressure, like she needs to push.
I just checked her. She's
I
pregnant.
know. I told her it's probably just because of the pressure, but I don't want her pushing.
She's +1. She's not going to. So we're just gonna have you don't see.
I didn't see how it already looked.
Right. And no extra bloody show. You're gonna feel more pressure because that baby's head is coming down. Okay, just kind of breathe through because we don't want to really get rid of that pressure because we're probably going to use a little bit of that when you push to have the baby, okay? But I'm here as close as the button, and it doesn't matter how many times you call me, I'll be here for you, okay?
Oh, I'm doing fine. That's fine. Just a little nervous, that's all. She having pain right now. But she'll be all right.
You're doing good. You're doing good.
There's so much pressure down there.
You feel more pressure?
A lot.
A lot? A lot? Like more than what we talked about a minute ago? It's all normal. It's not a problem. Don't push. Do not push. I don't see anything. I know you feel like you need to push, but it's the pressure. When the contractions come, just breathe, okay? Because if you start pushing before it's too early, it can cause your labor to go longer, okay? It can cause your cervix to actually swell up because you're not totally dilated, okay? So I don't need you to push prior to actually being completely dilated. Breathe, breathe, breathe. It's very important that you breathe.
Scoot over here just a little bit
She's
towards
pushing.
me. Oh, is she?
Yeah,
Yes.
look, she's pushing.
Oh, yeah, yeah.
Yeah. Okay, sweetie, you might just be ready. We'll see.
You feeling that contraction?
Push, 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 push.
She's ready.
She's ready? Okay,
We can take. So she's ready, and she's going to be pushing here, and hopefully not a lot of pushing. We're going to have a baby here.
The fluid has completely reaccumulated when we took it out on Tuesday.
4 days before her delivery date, Adriana is back to have her baby's cyst drained for the 8th time.
All the black represents fluid, and Raphael's just taking measurements of it right now.
Adriana and Juan Carlos know their baby's future is in grave danger. Even so, they've named her Danya and are struggling to be hopeful.
How do you feel about having another girl?
Happy.
Happy. Do you have a nursery at home, a room?
Danya's bedroom?
Yes.
Yes, yes.
Got it all ready?
Uh-huh, yes.
That's about right there. What do you think? Okay. Okay. You got me.
Yeah. Oh, right there. Well, baby was moving around so much, we actually had to manipulate the needle a little bit more than usual, so it's probably a little worse than usual. Minnie Mouse? Yeah. She's trying to move away from us. Smart kid.
I still think that there is a significant risk that the baby will have problems breathing when it's born.
Sin embargo, aún se ha hecho el procedimiento, el doctor dice que...
It might be so severe that all of the procedures we do, surgeries that can be done, still might not be enough to allow the baby to breathe on its own. If we did this with 100 women with the same problem, and you asked me what are the chances that the baby will survive, will make it, I think that probably about 20 out of those 100 babies would make it. I'm not saying this to discourage you. I want you to be optimistic and hopeful, but I want you to have a realistic understanding of where we're at. Okay, and what are the chances for your baby?
Lo que le está diciendo no es para que usted se...
And while we do what we think is best, we all know who's really in charge. It's not me, it's not you.
No es el doctor, es el más allá. Eso es lo que él quiere decir.
Okay.
Señor, momento.
Months of physical and emotional pain are reaching their peak for Adriana and Juan Carlos. Soon, they'll know exactly how ill their unborn daughter is. Due to the mass growing in her chest, doctors at Parkland Memorial Hospital give the baby only a 20% chance of surviving.
My biggest concern is how the baby's lungs are going to function after it's born. So I just don't have any way of being able to predict that.
Start time is 58.
Doctors Ramos and Coster have fully briefed a pediatric team. Once the baby is born, the team will immediately take over.
We basically just have to see how it responds to the resuscitation that the pediatricians will begin. And if it responds well, then that's a good sign. And if it doesn't, obviously that can be a bad sign.
He's removing some amniotic fluid to send for an LS ratio, which is one of the maneuvers to look for lung maturity.
The section forceps, please. You got them?
Yes.
Okay. There?
Hello.
Baby out now is going to be 17.
The fact that the baby can cry at all could be a good sign.
Good-sized baby, making some efforts. Go ahead and put some positive pressure on there, please. I'm not getting any heart rate. She's making efforts. What kind of pressure are you? 120. 120? I'm getting about 80. Thermometer on the right. You want to go ahead and prepare to intubate Michelle? Okay, let's get the tube taped, please.
18/5, weight about 35.
As long as we can stabilize the heart rate, and then...
Heart rate's 160.
Continue bagging, about 20/5, a rate of around 30 to 40 there, Kyle. Let's get the transporter set up. Kyle, you want me to take over bagging?
We've put in an artificial airway, and we are bagging the baby, so we're breathing for the baby right now. We were concerned that we might have to remove fluid from the belly and things like that to establish effective ventilation, but we've actually been able to establish a heart rate, etc., without doing those procedures. So
As the pediatric team fights to keep baby Danya alive, they also prepare her for transport to the intensive care unit. There, specialists will determine if she has enough lung tissue to survive. Jenny is finally sleeping after a restless night. She is dilating slowly, but her baby's heart rate now appears to be stable.
She was having some signs of early labor, where she had a few contractions, and with those contractions, she had what we call a decel, which is when the baby's heart rate goes down. But that was only in her initial presentation, and then she recovered.
I think she has pain, and she not sleep all the night. I don't know, I'm worried because it's almost 8 o'clock. We are here more than 10 hours. So I hope everything will be okay.
Within the hour, doctors decide a vaginal delivery is too risky. Jenny is prepped for a C-section.
And she does have a big baby. They're estimating the fetal weight to be like 9 pounds. So it's just possibly if the baby's not fitting.
Her cervical dilatation didn't change despite the fact that she had adequate contractions. So we have to take into account that there may be a problem with the way her uterus is contracting, or a disproportion in the size of her pelvis to the baby.
So the Army Navy, please, and can you put the bladder blade on the table? We're creating a bladder flap so we protect the bladder. Oh. Can I get a moist, please?
Alright, it's a boy.
Jenny's baby boy is a healthy 7 pounds and 12 ounces.
We don't like to do C-sections unless we definitely have a reason to, but it was just more important from our standpoint that we just get the baby out.
Baby.
I can sit there. Clean more kids will run out.
You just have to make decisions what's best for baby and mom.
Like Taiisha, Ariel Ramirez is going to deliver with a midwife. Right now, though, she's 5 centimeters dilated and having painful contractions. With her mother and sister by her side, her pain gets worse. She's getting close to delivery, so her doctors decide to give her an epidural now, before it's too late.
Okay, you just do your breathing.
No, you need to move back towards Lori.
Your hips all the way back towards.
That's the way. This hand here. That's the
You
girl.
can arch your back out like a cat on Halloween. Add to that.
Okay, you're gonna do the breathing, and you're gonna be okay. Whatever you're feeling is okay. You're gonna do this, okay? You're okay. You're okay. In and out. Slowly. Breathe in, blow out. Breathe in, listen to me, Ariel.
Breathe in, blow out. In, blow out. Now just relax. Just relax. You're okay. You're okay. Stay with it. Blow out. Blow out. Breathe in, blow out. Blow out. Breathe in, blow out. Ariel, blow out. Just relax. Down too. This one too. Excellent. Keep going. Keep going. Perfect.
Do you want, when after this baby comes out, can we put the baby on your tummy?
Ariel's midwife, Jill Coltharp, has delivered 575 babies.
Now, okay, that head is right. Look, if you look, can you see it? See in the mirror? Yeah, I can see it. Now, if you push, you really, when it's time to push, you'll really be able to see it, but he's right there.
Every day at Parkland Memorial Hospital, 15 women deliver babies with midwives in place of traditional doctors.
With my first baby, I had the mirror, so I saw myself give birth, and it was something that's still in my head, you know, like if it was yesterday.
Big, long, don't lift up. Don't lift, just push. There you go.
Once I saw his head, oh my God, I just pushed so hard, and he came out right away. And that's the way I want it with this one, you know.
It's amazing. It's just a miracle every time. So that's why I love it. I love what I do. Push, little push.
After only 4 hours of labor, Ariel is fully dilated.
Here he comes. Give me one more little push and he's out. Little push, little push. Look in the mirror. You got it. Oh, it's a little boy. Hi, Abraham. Look, Mama. Look. Here. I'll cut him out here. Hi, baby.
You're okay,
Hello. Hello. Let's dry you off. You want to cut? Yes, I've got him down here. Right between these two. Anywhere? Yep. There you go. Just put the scissors underneath her table. You get that. It was a wonderful birth. I mean, it was a wonderful birth. You know, there's nothing that really could have gone better with it at all.
It's okay. I hope he has his dad's eyes. We didn't get him with the first one. He has my eyes, so maybe he'll get this one. Because I'm not going to try for a long, long time.
Here you go, Mom. There's your son. Here you go.
Hit the data screen until I tell you to stop.
Okay, little friend. Window.
Adriana and Juan Carlos's newborn baby Danya is fighting for her life. Helping her win the battle is a team of Parkland's top pediatric specialists.
We'll be going to the intensive care unit. We'll be putting in some special IV lines and getting a chest x-ray to establish whether these lungs, there's enough lung tissue to really sustain life. You ready?
We're ready.
Go.
Monitor the high frequency and call for chest x-ray.
¿Tienen un nombre por la niña?
Danya.
Danya?
Danya.
Danya, okay.
But is there anything else you want him to know as far as the baby's concerned? Right now, all we've had to do so far is put in the airway. We're breathing for the baby, and the heart rate has been stable thus far. But the oxygen levels are not as good as they need to be. But we need to get over to the unit and try some different things.
So far, the doctor's efforts to help Danya breathe don't seem to be working.
Okay, you have to stop there.
Keep going.
Good, let's go.
We're still on the ramp. Pressure's up, and our temp's 33.9.
The cyst in her chest has filled up with air, pressing on what little lung tissue she has. As a last resort, she's hooked up to this machine.
The baby is on what's called ECMO, which is heart-lung bypass, and there's a pump that is basically doing all the work of the heart so the heart can take a break, as well as the machine is providing all the oxygen and removing all the carbon dioxide from the baby's blood, so it's essentially functioning as a lung. And we're letting the baby's lungs completely rest. We're going to see if, by taking the breathing machine down, that the cyst will collapse, and then we can see what lung tissue is left to actually work with. And at that, once we see that, the surgeons will decide whether they can go in and try to remove this cyst. It is critical to the point of minute by minute.
Kenya Fogi's C-section is over, and so is the near emergency that followed it. The presence of blood in the amniotic fluid raised concerns that she may have suffered a dangerous placental abruption.
She's stable right now. What we're going to do now for her is watch her blood pressure. So she'll be staying here in the ECU, the extended care unit, for a full 24 hours before we send her up to the floor.
Oh my God!
It's a boy.
Oh, you're so little, man. God, you look just like your brother too, man. I can smell you with, yeah. Yeah, you finally see Daddy, man. Yeah, now you know we've been talking to you all them days, huh? We was waiting for you to come. I wonder if Kenya and him was gonna make it, you know? I went down to the church, the chapel there. I was crying in there. I was just worried about him. I feel so happy. I can't believe he's out here now. I can't believe how small his behind is. I know he's just like his brother. His brother was small. But now his brother is like huge. I know the same thing is gonna happen with him. The smaller they are, the bigger they get. He looks so beautiful, man. Oh my goodness.
Kenya's vital signs continue to be strong. If she did suffer a placental abruption, it was a minor one. The major concern now is her high blood pressure.
She's at risk to have seizures. We're doing our best to prevent that with the magnesium. That's been the best medication proven to prevent the seizures.
She's a strong girl. And I got 2 strong babies. You know, along with their mom.
For the next 24 hours, Kenya will remain in serious condition. It's 3 days after Elia Campos's emergency C-section. She and her husband, Alejandro, are visiting their twin boys in the neonatal intensive care unit.
When we brought them back to the intensive care nursery, what we ended up doing was putting both of the infants on the ventilator. Well, at this time, both babies are critically ill. They're both on the ventilator. They're both requiring a fair amount of support. So we would consider them to be critically ill.
I'm always very happy to see my baby. But when I see him like I see him now, I always get concerned.
Both of the 2.5-pound babies are in danger. But the second-born twin, Albert, is faring better than his brother.
So what we're treating at this point in time is a disease called hyaline membrane disease, which occurs in anywhere from 20 to 50% of low birth weight preterm babies. The apparatus that you see here is holding the tube that goes to the baby's lungs, and it's connected to a ventilator, and we're basically breathing for the baby at this point in time.
The firstborn twin, Alex's disease, is more serious.
The baby is on what we call high-frequency ventilation, and requires a lot more equipment around it at this point. This is a breathing machine or a ventilator that permits us to breathe much more rapidly than the baby could breathe.
Despite the critical condition of their babies, Elvia and Alejandro have good reason to be hopeful.
They did explain to us that if they get better in the next coming days, in the next 2 months, we will probably be able to go home.
If there are no major complications, then the prognosis becomes reasonably good. In our institution, babies who have this birth weight and this gestational age have a better than 90–95% chance of survival with a very good outcome.
Alex and Albert will remain under constant care at Parkland for several weeks, but the long-term odds are well in their favor.
Yeah.
7 hours into labor, Taiisha is fully dilated and ready to give birth.
Oh, hurry, Daddy. Come on, Daddy. Push it again. And push. There you go.
If you push, we can get this part of it out of the way. Just push. Come on again.
One more time. Come on, don't stop.
Pass that chain.
Yeah.
You got a baby here.
Baby delivers baby.
Oh, she's a cutie. Look, Dad. You see your baby? Cutie here.
I think Taiisha had a really nice delivery. Even though it seemed like at the end she was in a lot of pain, but sometimes you need that oomph to push the baby out. And she had a little bit of discomfort, but it was more in just the very last bit of it. And I think she had a really great delivery for a third baby. Baby looks really normal, healthy, pink, just a really nice looking baby.
Okay, little one.
The baby weighs a healthy 6 pounds, 12 ounces. Her parents are thinking of naming her Ronnie after her dad.
Okay.
We want her skin right on you, okay? Go ahead.
There we go.
There you go.
Did you want to breastfeed, baby?
She hears your heart probably right now. And that kind of makes her real calm because she's pretty cute.
In the 5 years I've been here, do over 1,000 deliveries. It's been a real gift. Lots of beautiful mommies, lots of beautiful babies.
She's cute. She's just so delicious.
Less than an hour since her birth, baby Danya's condition continues to be critical. She's been moved from Parkland Memorial Hospital to the neonatal intensive care unit at Children's Medical Center of Dallas. A machine is delivering oxygen to her vital organs, but that may not be enough.
The cyst, which has caused all of her issues both while she was in the womb and in the immediate postpartum period, has increased in size, and that affects her cardiovascular function and affects the functioning of the ECMO system.
But it really doesn't.
Danya is far too fragile to tolerate surgery to remove the cyst. The doctors are quickly running out of options. And her parents' hopes are fading.
Pienso lo mejor para ella, pero al mismo tiempo.
I really want to think the best for her and have hope. But when I really think about what's going on, I don't have much hope. I believe in a superior being, a force, who will decide what's going to happen to the baby.
Worst case scenario is that she doesn't survive.
God gave me the chance to see her, and my daughter has proved to be strong. She fought a lot to get to where she is now.
And now the nursery. On our way, we'll drop by and see the dad.
After hours of worry about Jenny's difficult labor and delivery, Felipe Corrales finally meets his newborn son in Parkland's nursery.
She wants to call him Maurice, but I'm not sure. I want to teach him about the cars, about the football. I want to be him a good man.
Jenny is resting comfortably now that the hardest part is over.
Mom and baby are fine. Everything went just fine. Baby did not have any type of a sign of an infection, and mother's being treated with IV antibiotics, and I think they'll have a normal recovery course.
Can she speak?
Tired, hungry, in some pain, Jenny's experiencing a whirlwind of sensations.
I feel hurt and cold, but I'm feeling happy too. I have a big baby, really big.
Well, congratulations.
Thank you.
Enjoy your baby. Bye-bye.
Bye-bye.
1 hour after her C-section, Kenya is recovering under careful observation in the extended care unit.
There you go. How you doing, Ma? You are the woman. You did it by yourself. By yourself.
Kenya will remain here for at least 24 hours. But that won't stop the new family from sharing the magical first moments of a new life.
I seen him, he about this big, Kenya. When he was smaller than Shakur, I can hold him with one arm, just like Shakur.
Yeah, I was kind of nervous doing that C-section. I didn't know what was going to happen, but they did a good job. They took the baby out quick. I'm surprised I did it again.
For the first time since she delivered, Adriana sees her critically ill baby. The small window of hope for Danya's survival is closing.
One of the pupils became dilated and ceased to respond by constricting to light. We obtained a head ultrasound to look at the brain and saw there was a massive bleed into or around the brain and no flow of blood to the brain on that side. What it means is that we can no longer provide ECMO support for her, so we'll have to discontinue ECMO support this afternoon.
Without the ECMO providing heart and lung function for Danya, it will take a miracle for her to survive.
My daughter proved herself to be strong enough. And if God chooses to take her and asks me for her, it's because he wants to take her as an angel.